I'm Vas Sadda. I'm the director of the Medical Retina Unit and also the Imaging Unit at the Doheny Eye Institute, which is at the University of Southern California in Los Angeles. This explosion in diagnostics really is something that's critical for every ophthalmologist and retina specialist to understand. And so what's really unique, I think, and exciting about the new edition of Retina is now it's really built into really half a volume almost. I mean, a real new section devoted to retinal diagnostics, reorganization of how it's presented, but most importantly featuring the latest in advances in the technology and even a directional look into the future, because we anticipate that the field is changing so rapidly. It's really critical for someone who's trying to gain a good understanding of the field to understand these new directions. And I think, as I said, that's what I feel is particularly exciting about the new edition, is because it really presents that in a fashion that is easy to grasp and is self-contained and really covers everything you need to know. I think it's great that the text is going to be very responsive to this new era in terms of how people, I think, are going to consume information. I mean, I think, as a traditionalist, it's great to have the textbook itself and the feel of flipping the pages. That's really nice. But there is content which is really difficult to provide purely using a paper medium. And one of the things in ophthalmology, and particularly in retina, is our use of diagnostics, which are sometimes dynamic, including ultrasound, which can be captured in a dynamic fashion. And some of the information can only be related in its best form through a dynamic video type of presentation. And even some of our imaging studies, dynamic indocyanine green angiography or optical coherence tomography, in terms of our ability to visualize three-dimensional objects and structures. And I think this is where it's great to have e-content where you can really do this. In addition, I've talked a little bit about how much the field has changed, how much there's been in terms of dramatic advances in the diagnostics as well as the therapeutics. Sometimes there's content that you can't even contain in even the written volume, and the e-book also providing access to additional online type of material certainly will be exciting. But I think that's what we're going to see more and more is consuming these things in electronic fashion. Obviously, there's a portability issue, having it at your fingertips in the office while you're in the exam room while you're examining the patient. I think that's a great advantage. I still think it's great having both, but certainly the e-content is critical and allows us to really take the book beyond where we could before. So certainly Dr. Ryan is the individual who's been a great inspiration and mentor to me, and it certainly is the one who has brought me into this. Now, this is the first print edition of Ryan's Retina that I've worked on, but I've been working on the previous edition for some time now as the editor for the electronic version, the web version, in particular focusing on adding additional content. So I've gotten a chance to interact with the whole editorial team as well as Dr. Ryan and the publishing staff in terms of doing that and really getting a good in-depth feel for the book. But certainly, Dr. Ryan has really been an inspiration. He's the president of the Eye Institute that I work at, so I get a chance to, and a privilege to work with him on a regular basis. And certainly, this is an edition that not only all of the editors, but our chief editor, Dr. Ryan, have been really excited about. And I will say that it really is the most comprehensive revision to the text in all the editions so far. I mean, it really is a dramatic reorganization of all of the content, which I think is really responsive to the changes in our field in the last few years. This is a very visual field in retina. We have these wonderful imaging technologies and devices, and we spoke a little bit about the dramatic changes in the field of imaging. And so imaging technology is rapidly advanced, and so now we have these new images, for example, captured with spectral domain OCT devices. In the past, there were old time domain images that were in the text, and now these have been replaced by these beautiful spectral domain OCT images that give us so much more detail and so much better understanding of the disease process. So that, and as well as the fact that we've brought on board so many additional experts, people who are really, the people now who are really pushing and driving the field forward, they bring their additional perspective to build on the already the content that's already there in the text. And so, of course, with them comes a lot of new images, again, taking advantage of these new imaging technologies.